Hi friends, my name is Dr. Aakash Ahuja. I'm a board certified physician and I live in Santa Clarita, California, like most of you. Today is March 17th, 2020, and as I speak, more than 100 people in United States have died to coronavirus. It has become a pandemic and we are all trying to deal with this. Bars, restaurants, social gathering places, churches, restaurants are all closed, and we are all trying to stay at home, maintaining the social distance from each other, and performing the good hygiene habits. A lot of people have been talking about flattening the curve to cure or to deal with coronavirus. And I thought that I'll let you explain what exactly do we mean by flattening the curve. So let's look at a graph which I've taken from a media and then see if I can explain it in a simple way as to what exactly does it mean. So before I can start, I like you to focus on the three lines. This line, then this line, and then the middle line. This line is basically the number of cases starting from 0, and as we go up, the number of cases increase. This line is the time since the first case. Starting from 0, that's when the first case came in the community, and then the time goes on and the number of cases increase. And this is a very important line known as healthcare system capacity. And I'll tell you in detail about that in a second. Let's look at this orange curve. This orange curve has a big peak, as we can see, and it says that without protective measures, what it means is that when a society, when in a community, people are not following the basic hygiene ways, like washing their hands and maintaining the social distance, then the virus, the coronavirus, COVID-19, can spread from one person to the other in a very fast way. And it can lead to the number of cases going up like this in a very short span of time. So what's wrong with that, right? So what happens with that is that as we see, the peak of this orange curve goes above the healthcare system capacity. What that means is that every society, every community has limited healthcare supply in terms of number of hospitals, in terms of number of hospital beds, nurses, doctors, incubators, and different facilities. And when many cases come at once, it bombards the system in such a manner that it becomes an extremely difficult job for the healthcare system to take care of it in the best possible manner. We all know what happened in Italy, where the doctors actually had to make a choice in terms of who they want to treat the best and who they do not because of scarcity of resources. We do not want that. We are the best country in the world, but we also have our limitations. Now let's look at this blue curve, which this is what we want. If you notice that this curve does not have as significant peak as the orange one. In this one, people are following what we call that they are using the protective measures in terms of hand hygiene, in terms of other things, in terms of maintaining the social distancing, which is leading to flattening of this curve literally. As you can see, this curve is more kind of curvy and this is more flat. So when we flatten the curve, what that means is that we are still going to get the cases of coronavirus. People will still get sick, but the rate at which people will fall sick or will spread the infection will be much lesser than as compared to this orange one. And when that happens, then the hospital, the system, the country, the society would be able to deal with each and every case in a more judicious and the best possible manner. So guys, this is basically the idea of flattening the curve. Guys, we are all in this together, and by maintaining the social distancing and by maintaining the hygienic methods as per the CDC guidelines as per our local health authorities, we can definitely flatten this curve literally, and then perhaps deal with this coronavirus in the best possible manner. This is Dr. Aakash Ahuja signing off. Thank you.